The practice of medicine in olden times was mostly analyzed to be a practice of guesses, assumptions, and theories. It was about hitting the bullseye and getting it spot on. Imagine this bullseye was as tiny as your will to wake up early on a Sunday morning. Haha, that would be impossible to find, right? Well, similarly in medicine, some cases have a narrow bull's eye to hit. So here it becomes important to be accurate and rightful investigations come to our rescue. But what if at times they don't? What if we do not have the time to assess the organism? Or what if we do not want to wait? Well, dramatically, prayer is an option that might work, but clinically, our best option would be something that hits a broader bullseye and works on a wider spectrum, and that is how broad spectrum antibiotics were born. As microscopic as today's organisms get, the way to tackle them gets broader day by day. Broad spectrum antibiotics are an example of the classic killing two birds with one stone proverb, where these drugs act both against gram-positive and negative organisms alike. The spectrum of activity characteristic divides antibiotics into broad and narrow spectrum. These broad spectrum antibiotics are further divided into two large groups, tetracyclines and chloramphenicol. And for this video, we will be focusing on tetracyclines. Examples of tetracyclines currently in use are tetracycline, oxytetracycline, demeclocycline, doxycycline, and minocycline. From the name itself, you can say that cyclines have 4 cyclic rings in their structures. Mechanism of action. A part of one of the DNA strands contains the code for protein synthesis. This part of the DNA strand is read by the enzyme RNA polymerase to synthesize mRNA, and this process is called transcription, which is similar to copying the code or message from the DNA. Hence, M for messenger RNA. This mRNA acts as a template for protein synthesis. Ribosomes attach together like a sandwich around the mRNA and attract transfer RNA. Transfer RNA or tRNA is another type of enzyme which has an anticodon site. Similar to how magnets come together on opposing poles, this tRNA binds to its respective opposite codon site on the mRNA. This tRNA carries the amino acids along to the mRNA, and these are linked together to form proteins. Bacteria spread in the body through replication, which requires transfer RNA to bond with a messenger RNA complex. Further, we will see how these drugs act. They mimic a barricade blocking people from entering the building. Here, the people are synonymous to transfer RNA, which cannot enter the building of mRNA ribosome complex. Their mechanism of action is that they inhibit protein synthesis by binding to the 30S ribosomal subunit of the bacteria. This bind interferes with the attachment of aminoacyl tRNA to the acceptor site on the mRNA ribosome complex. Since this attachment is disrupted, the addition of amino acids to the peptide chain is blocked and new proteins are not synthesized. Hence, tetracyclines are mainly bacteriostatic. The name broad-spectrum antibiotics is given because these drugs have a widespread action over a plethora of bacteria. But now, indiscriminate use has caused many organisms to be resistant to these drugs. Initially, all gram-positive and gram-negative cocci were sensitive to tetracyclines. But now, only a few such as Streptococcus pyogenes, Staphylococcus aureus and Enterococcus respond. Now, tetracyclines are highly effective only against Neisseria gonorrhea and Neisseria meningitidis. Most gram-positive bacilli are inhibited by tetracyclines with the exception of mycobacteria. Many previously sensitive gram-negative bacilli like V. cholerae are no longer sensitive. But what is resistance? Resistance, as we know, is the ability of the microorganism to adapt to the action of the drug. The resistance to tetracyclines develops in a graded manner, that is, slowly increases in levels. Resistance occurs either due to bacteria acquiring the capacity to pump the drug out or the concentrating mechanism of tetracyclines becomes less efficient. Another mechanism for resistance is the synthesis of a protection protein which protects the ribosomal binding site from the drug. If you remember, binding to the ribosomal binding site is how tetracyclines work. Due to uncontrolled and widespread use of tetracyclines, resistance has become common in gram-positive cocci and many others, and complete cross-resistance has been observed. Cross-resistance is a resistance to different tetracyclines by the same mutation of the bacteria. Let's now move on to the pharmacokinetics of tetracyclines. The older tetracyclines are incompletely absorbed from the GIT and food interferes with their absorption. On the other hand, doxycycline and minocycline are completely absorbed irrespective of food. Tetracyclines form insoluble and unabsorbable complexes with metals like calcium, so milk, antacids and sucralfate reduces their absorption. Once absorbed, tetracyclines are widely distributed in the body and are mainly concentrated in the liver, spleen and gingival tissue, and also binds to the connective tissues in bone and teeth. Their excretion is mainly in urine by glomerular filtration, so if the patient has renal failure, the dose has to be controlled. But doxycycline is an exception for this case. Tetracyclines have the tendency to get accumulated and deposited into growing bones and enamel, so they are contraindicated in pregnancy and nursing mothers. If they are administered during the last half of the pregnancy, permanent greyish-brown discoloration occurs in the newly forming deciduous teeth of the infant. Tetracyclines being administered in pregnant mothers can also cause the deposition of the drug in the bones of the forming fetus, leading to bone growth inhibition, limb abnormalities and cataract. It is also not advised for children under the age of 8 as it can cause deposition in the forming permanent teeth. How is it administered? Most commonly, oral capsules are given. These tablets should be given half an hour before or 2 hours after food. Intramuscular administration is not recommended because it is very painful and the absorption is poor. Being a drug, these also have their own side effects. The side effects include irritation, organ toxicity on excessive use, hypersensitivity reaction, that is an allergic reaction which is quite uncommon, and finally a superinfection because tetracyclines cause the suppression of the normal flora. A superinfection occurs when the normal flora for the body is inhibited, so any other disease causing bacteria can easily cause a disease without the competitive inhibition of the normal flora. Now, for the important part, the use of tetracyclines in dentistry. Their role is limited in acute dental infections, but they are very useful adjunct in chronic periodontitis, which is resistant to other antibiotics. Doxycycline is useful for subgingival plaque. If you recall, doxycycline gets accumulated in the gingival tissue fluid. The concentration of tetracyclines in gingival clavicular fluid is 2 to 10 times higher than that in the serum. They also benefit certain forms of periodontal disease by suppressing the activity of matrix metalloproteinases, enzymes which contribute to gingival inflammation. When antibiotics are started for an infection, the complete administration of the course is advised even if the symptoms are resolved. This is because taking only a part of the course might only suppress the symptoms and not kill the bacteria. So the leftover bacteria which would have been killed by the rest of the course might cause a relapse of the infection or worse, develop resistance to the drug. Before you get started with another topic, don't forget to revise. The best way to do so is using a mind map. Let me help you summarize the topic in under 2 minutes using a mind map. To summarize all that we've learned today, tetracyclines are a class of broad spectrum antibiotics which have a wide range of use in our day-to-day life. A few examples of tetracyclines are tetracycline, oxytetracycline, demeclocycline, doxycycline and minocycline. These drugs act by interfering with the bind between the amino-acyl tRNA and mRNA ribosome complex. This stops the synthesis of new proteins, leading to its bacteriostatic effect. These drugs are taken orally and are absorbed normally, but the presence of food interferes with its absorption. They form insoluble complexes with metals, hence are not taken along with antacids and milk. Tetracyclines are concentrated in the liver, spleen and gingival tissue, hence it is used in chronic periodontitis, and they are excreted mainly through the urine. They are administered orally. Intramuscular is avoided as it can cause pain and absorption is poor. Few of the side effects are organ toxicity, hypersensitivity reactions like allergic reactions, and may cause a superinfection. In dentistry, it is used in chronic periodontitis as tetracyclines are accumulated in the gingival fluid 2 to 10 times that of the serum concentration. They are also used to reduce inflammation by suppressing matrix metalloproteins. Contraindications of these drugs are pregnancy, which might lead to grey discoloration of teeth, bone growth inhibition, and cataract in newborn. Children under the age of 8, in which they might cause grey discoloration of the permanent teeth. If you want to access such mind maps for free, log into our website and mobile app and enjoy revising. If you are stuck with me till now, I am sure you enjoyed the video. Please do like, share and subscribe to the channel. It makes up for all the time and effort we put in to make concepts so simple and easy for you. Hoping to see you in the next